Welcome to the Cancer Support Suffolk podcast. Join me, Mark Murphy, and my brilliant guests as we talk about life before, during and after cancer. Hello, I'm Mark Murphy, the CEO of Cancer Support Suffolk, and welcome to our latest podcast supported by the Suffolk Community Foundation and the Suffolk and North East Essex Integrated Care Board. This month we're talking to Dr. Liz O'Riordan, who's a breast cancer surgeon who is herself on a breast cancer journey. She's an author and speaker. Her books include The Cancer Roadmap and The Complete Guide to Breast Cancer. Liz, welcome to the podcast. I feel like I know you. I follow you on social media, your LinkedIn posts particularly. So when you walked in, it was like, oh, hello, hi, like we've known each other forever. I
get that a lot. I now get recognised in airports and it's really strange, but it's lovely.
Yes.
But I do forget how much of my life I share.
Yes, and you are making a huge difference by doing that.
Thank you.
You really are. It's not easy to do and share in the way that you do, but you're making a huge difference. And we'll talk about online stuff a little bit later on in our chat. But you were a breast cancer surgeon, so was that something that you always wanted to get involved in, that kind of surgery?
I knew I wanted to be a doctor from when I was a little girl. My dad was a GP and a surgeon. My mum was a nurse, fascinated by the human body. And I was lucky enough to see an operation in the sixth form, and I was just fascinated by this wiggling bowel lifted up out of this abdomen. This is what I need to do. I'm a pyjama wearer. I want to fix things. I want to cut people up and make them better. And I loved every branch of surgery. And a wise man once said, you pick the body fluid you mind the least, and there isn't any with breast surgery. And there's no out of hours work, there's no on call. And it's really creative. It's like dressmaking and origami. And I just fell in love with this speciality. But I didn't realise how hard it was until I became a consultant myself at Ipswich down the road. Because you're suddenly being paid to make women cry. And you're taking on all that emotional upheaval. And I didn't get that as a trainee, but it was such a privilege to be able to guide women and men and their partners through this journey.
And you've subsequently gone through this yourself,
Yeah.
so you've now got more of an idea of what those patients were going through. Obviously, you've got a job to do. You've got one patient after another another. It's really difficult, perhaps, to spend quality time with those patients as you're the consultant, because you've got so much to deal with, haven't you?
It is. And I think the thing with breast cancer is you never know what's going to walk through the door in clinic. Most people don't have breast cancer. You can't plan for the number of results or bad news you're going to give. We would be allotted 10 or 15-minute appointments, but some women need an hour. You're always running late. You're always apologising. You want to give people the best of you, but it's really hard. And I used to think doing a good job was like a pretty scar hidden around the nipple that you couldn't see or no recurrence. And then when I became a patient, I realised there is so much more to it. It affects every aspect of your life, the mental health, the physical health, the body confidence, intimacy, everything. And I had no real idea because I was just focused on the latest trials, the latest treatments to give my patients the best care.
We talk about breast cancer as a sort of overall, coverall kind of topic,
Yeah.
but there are so many different types of breast cancer, aren't there? So every case is very different.
It is. So there are 13 different cells it can come from. There are 4 different combinations of receptors, plus you've got cancers that are fast and slow growing. Everybody is unique. You can't compare yourself to anybody. And that's why it's such a complex disease to treat.
And also difficult for an individual to perhaps sometimes know that there's something wrong. We talk a lot about know your breasts.
Yeah.
You know, there are mammograms to have. There are all sorts of, campaigns to get you to feel, grab a feel or cop a feel, I think it is, isn't it? Various different things. But there are some that are even through that, they're difficult to find.
There are, and I'm going to be honest, Mark, I never checked my breasts. I was diagnosed when I was 40. I thought, I'm a breast surgeon. It's not going to happen. And I think most of us aren't taught, or we think we don't know how to do it properly. And unless you know how to do it properly and you do it regularly every month, you can miss really subtle things. A lump is often the first thing people see, but it can be nipple discharge, it could be a dimple, it could be a lump in the armpit. And that's why, although I hate October because I'm very aware of breast cancer, learning what the signs are, doing it every month can really help, because the sooner you find something, and this, I think we should actually check all our bodies. We should check our poo for blood, we should check our wee for blood, check our genitalia, check our mouth. The earlier you find something, the better a chance of a cure you have.
It's absolutely crucial, isn't it? Early diagnosis for outcomes makes a huge amount of difference. So let's fast forward. So you're a very successful breast cancer surgeon. All of a sudden, what did you notice?
So I'd had a couple of lumps in the years before. They were breast cysts, and that's common in your late 30s and early 40s. I had very lumpy breasts, and I'd had a mammogram 9 months earlier. And that was terrifying because I imagined I just got engaged, I'll be dead, my husband won't want me, the hysterics that you go through. I came out the shower and I noticed a lump in my cleavage. I thought, oh, it's just another cyst. It looks like it. And I'm an expert, remember. I thought it felt like a cyst. My surgeon thought it felt like a cyst. We had a mammogram that was normal. And then I had an ultrasound scan and I looked at the screen because I do ultrasounds and I saw a cancer. And whereas most patients are drip-fed information, you have a biopsy, get the result of a test, I knew I'd need chemo. I had a good idea what my chance of being alive in 10 years was. And it was like I dissociated. This isn't happening to me, it's happening to someone else. And 3 weeks later, I was in the chemo chair.
Wow. When did you realise it was you?
I don't know whether I still have, actually. I think because I'm a surgeon and I've looked after patients who've died of breast cancer, there's that scary part of my head that I don't want to admit could be real. And even now, I don't think I've had breast cancer 3 times, but it's the low moments during chemo when you're sat on the shower because you can't stand up crying, just feeling I've lost my pride and my dignity. Or when you look at a child and think, cancer took my fertility away, or that fear of a scan and what it's going to show. There are moments when it kind of comes in. But it took 3 or 4 years for me to get to that stage.
And treatment-wise, so you've had 3 experiences of this?
I have. The first time I had quite a large cancer. I had chemotherapy first to shrink it down, then a mastectomy and reconstruction, radiotherapy, hormone blockers. It came back on my chest wall as a nodule underneath my armpit about 2.5 years later, back in 2018. That was more surgery, radiotherapy, change of treatments. And then in 2023, I was just cycling in the Italian mountains and I noticed a little ulcer above my mastectomy scar. And that was a second local recurrence. So I'm now on treatment for life to stop it coming back. But my last scan showed I am cancer-free.
Treatments have improved dramatically, haven't they? You're smiling and nodding for those who are not in the room with me. An early diagnosis we touched on, that's crucial. So crucial, but treatments are now much more bespoke than they ever were.
They are. So in the last 8 years, there's been about 10 or 12 new treatments just for breast cancer alone. We are looking at specific genetic mutations in individual cancers. We have treatments tailored for those. We're now looking at vaccines for some type of cancers to potentially make it a chronic disease. It is incredible how quickly research is growing, and there is hope. Survival rates have doubled in the last 20, 25 years. It's amazing what we're doing.
Sadly, some people tragically are still going to lose their lives because of it, depending on the type of cancer, depending on how advanced it is before it's found. You touched on self-examination there. 25% of people in Suffolk don't go for their screening appointments, be it cervical or breast or whatever it might be, bowel, fit tests. What do you say to those people?
It's really hard because I get a lot of us are working now. It's inconvenient to take time out in the afternoon to go. You think, I'll do it later. We try and make it as easy as possible with screening vans in supermarkets, but you think it won't happen to me. I mean, cancer is everywhere. You just want to, I'm fine, I'll be fine. But then you're not. And we now know that people who get diagnosed later who miss screening don't have as good an outcome with breast cancer. I think it's that awareness. Screening only works if everybody goes, because you need to screen enough people to pick up the cancers. And it is your choice to make. People wrongly believe that mammograms are dangerous or this is that, but it's just...
It's slightly uncomfortable, isn't it?
It is. It's a bit uncomfortable having your boobs squeezed. And mine was painful because I was young and they were quite dense. It's not the nicest thing in the world, but it takes about 5 minutes in total. You get a result, you're done. I think it's really important to go for screening because if we can find something before you notice the signs, it's less treatment. But a lot of us don't know what the signs of cancer are. I know we might talk about my mum earlier. My mum had bone cancer. She had a lump on the back of her arm. I'm a doctor. My husband's a doctor. Her husband was a doctor. We had no idea what this was. It was only 4 months later when she broke it, we realised it was bone cancer. And I think it's easy to put your head in the sand and think, it won't happen to me. But cancer is on the increase, especially in the under 50s. And I think we all need to do what we can to help doctors.
It's 1 in 2 of us now will get a cancer diagnosis.
In our lifetime.
If it's not us, it's someone very close to us, isn't it?
Well, I've had it 3 times, so you're let off the hook.
Okay, I'll keep my fingers crossed on that one. But checking, making sure that everything's okay, having regular checkups is the message today. But also, something that impresses me is that you are so open on social media and you do talks to people, as we do here at Cancer Support Suffolk. We're always out and about encouraging people to get their checks. And I had someone else on the podcast a few months ago who had cervical cancer, and hers was picked up through screening. And she said, I try and do all I can to encourage people to go to their screening appointments. And I said, well, what do you do then? And she said, well, I put it on my Facebook page. I'm now off for my smear test. And I went, oh. And she went, oh, yeah, you'll be surprised at the amount of comments I get. And we do need, we talk about, I've got to go to the dentist. I'm going to the hygienist later this week. I'm not looking forward to the hygienist, actually. But we need to be talking about this because it is affecting all of us, isn't it? It's not something that we can brush under the carpet. It needs to be a big, open conversation.
It does. I mean, when I was training, we never said the word cancer. It was neoplasm or malignancy, and don't tell the patient what they have. It needs to be a normal word. That's why I've had myself videoed having my mammogram and I kind of screen my colonoscopy. It's a normal part of what we do. But I also think there's a massive public health education thing we need to do. CRUK said that if every person in the world drank less, exercised more, was a healthy weight, didn't smoke and wore sunscreen, we would stop 4 in 10 cancers. Now, the impact on you and I individually to our cancer risk is very low, but if everybody does it, we would stop people dying, save a hell of a load of money. It would be amazing.
It's really quite simple stuff, isn't it?
It is, but it's boring and it's not sexy and no one wants to watch those reels on social media. Yeah, go and exercise. I can't be bothered. But it's true. And I think we need to get into schools and universities and tell people these are things you can do to reduce your risk.
Well, it's what we're passionate here about Cancer Support Suffolk. Our educator, Kimia, has had her own cancer journey very recently, had colon cancer. She's okay now. But she's out at businesses, community groups, schools, delivering exactly that kind of message every day. And we use our socials as well to do that. You're the queen of social media. I follow you all the while, and I think, what's she up to now? But they're very engaging, your posts. They're very raw, they're very personal, they're very engaging. They hook me in, and it takes a lot to hook people in these days, doesn't it? But I stop, and as you know from what I said earlier on, I stop and have a watch of yours. More of us should be doing that kind of thing. But the worry, I know, is something that concerns you, are fake posts, misinformation, fake news. I mean, it's everywhere, isn't it? It's all over, it's all pervasive. And yet we see it all the time. Even here at Little Old Cancer Support Suffolk, we'll put a Facebook post up, and then in the middle of that, you'll get somebody from goodness knows where posting, "Oh, you don't want to take this. You want to have this herbal remedy or whatever," and we delete and block as quick as we can. But there's so much misinformation. How frustrating is that for you?
So it's funny, Mark, as a doctor, I had no idea this was out there. I never looked at breast cancer forums, but as a patient, when I started talking, people would ask me, is it true that deodorants cause breast cancer? Will matcha tea cure me? Should I be taking turmeric? And there are people making huge amounts of money. The wellness industry is worth 4 times what the pharmaceutical industry is. Podcasts, reels, we have the attention span of a gnat. We now know that testimonials carry far more weight than a doctor. And in America, half of cancer patients don't trust their doctors. And it's very easy because it's clever marketing. Come and do this. If someone says they're cured of metastatic cancer, but that could be a day after taking the supplement. If there's no follow-up, people don't care. They're taking so much money from vulnerable people. But the thing is, when you have cancer, you're vulnerable. You want certainty and hope and the promise of a cure.
You'll try anything.
You will. Exactly. And that's what these people are offering. And the thing is, we can only prove you're cured if you die of something else. And I get people saying, my oncologist said this was safe and my doctor said it's safe, but I saw TikTok said I shouldn't do it. And they come to me. And the amount of work it takes, like someone said, drink matcha tea to cure cancer. Well, I have to go and say, well, that was done in a lab, put on cells. And to get that dose in a human, you'd have to drink 300 cups in an hour and that could kill you. It takes time and it doesn't cut through. And it's how can we train people to realise that a lot of what you see on social media isn't true. They're making money off you. You wouldn't buy a car like that. But with our bodies, it's quick, it's easy. You kind of feel better because you're taking a supplement. And the thing is, these supplements can interact with medicines. Tamoxifen, especially for breast cancer, can interact with a lot. It stops it working. There's a study that shows if you choose alternative remedies, the stuff peddled on Facebook, over traditional treatments, you're twice as likely to die. And for bowel and breast cancer, it's 5 to 6 times more likely to die.
I don't know why we don't trust the medical profession. I mean, I do. I do. And a lot of people do. But there is a lot of mistrust of authority today.
Yeah. I think it used to be the power balance. The doctor knows best. Yes. And I now know that we don't because we're not living with this disease. But doctors aren't online telling you chemo is great and we're curing cancers. They don't have the time to put these videos out there. And because you're treated for free in the UK, we feel we don't need to promote what we do. But there are so many other people out there making a living. And it's like spas and clinics and sunflowers and we'll look after you and we care. Doctors don't know that's happening. And there's just kind of mistrust. Do they know everything? And we don't know everything, but we need trials. We want a trial to test. Turmeric may cure everything, but I want to test it. What's a safe dose? Are the side effects? Give you all the pros and cons, rather than just go and take a load of stuff. And I think it's a massive, massive problem because you can say anything online. No one can stop you.
We're seeing it in America, aren't we? Big time at the moment with RFK and Donald Trump. And, that's starting to filter its way across to the UK at the moment.
Well, take the case of Paloma Shomorani.
Yes.
I was involved in doing that. So for those who aren't listening, she is a young girl. She was a Cambridge grad who got lymphoma in her chest. Paloma was persuaded by her mum just to do juicing and coffee enemas. She lost 30 kilos. The cancer grew. When it was growing in the lymph nodes under her arm, her mum said that's the cancer coming out. She basically suffocated because she had this tumour pressing on her heart and her lungs, and her mum still believes the doctors killed her. And this happened last year. People in the UK are dying because they are choosing alternative therapies, and it breaks my heart.
You have a great presence online. You know, you try all the time, and I see your regular posts. You are trying to bust these myths all the while. Should the NHS be doing more of that, myth busting themselves?
I think it's really hard. Where is the time and money going to come from where's the time and money going to come from to get the doctors to do this? I think they can try, but we don't go to the NHS website to get our health information. If you broke your leg, would you go to NHS or GP website, or would you go on Google or Chat GPT? It's not sexy. People don't think it's down with the kids. That makes me sound really old. But I do think we need to do more education and just reminding people, if you see something online, will you fact check it on two sensible resources like CRUK, like the NHS, before you spend your money? We need to reach people, to train them that Facebook is full of people trained to infiltrate and pretend to be cancer patients to get you to buy their stuff.
And, you know, I'm a journalist. It was my career for a while. I'm still a kind of part-time journalist now. And I'm really, really upset about the amount of false information that goes out. The mainstream media fact check.
They have to.
We have to. That's our job. We are legally bound to do that. And people don't believe the mainstream media, yet they'll believe some TikToker, some celebrity. And you think the world's gone mad.
I know. You trust that everything I'm saying is true. You don't have the time to go and fact check everything. And there are podcasts with huge audiences who get on loners, who have a really shocking statement and they assume it's true, and it goes out and it's cleverly marketed. The first 60 seconds, wow, it must be true because they were on his podcast.
Yeah, but I've done my due diligence on you. So I know who you are.
Exactly.
I know your background. I've researched you. That's why we invited you onto the podcast. So you are an authority in your field, whereas others just come on and spout absolute nonsense.
Yeah,
and there's no one checking.
Like Joe Rogan and Mel Gibson. Did you see that podcast when he said he's had 3 friends who were cured of stage 4 disease with worm treatment and methylene blue? And then suddenly my posts are flooded. Is this true? And you then got to stop your day and research. And I honestly don't know what the answer is.
We need more people like you. That's the answer.
I think we do, but it comes back to training in schools. When you see stuff online, it's not true. Chat GPT isn't always true, because if everyone is saying methylene blue cures cancer, Chat GPT believes it. It's when you used to go back to the library and the encyclopedia, and you'd have to go and research things in a proper book that had been fact-checked.
Yeah. And there was a time when people didn't believe what they read online, the internet, or this internet thing, you know. But of course now people do, unfortunately, believe that. I mean, you are an inspiration. How are you now in yourself? You have ups and downs, I know, because I follow you. So how are you now?
I've had a pretty tough time on one of the cancer drugs I've been taking. And I think I didn't get the collateral damage of cancer treatment and how it can last for years. The depression, the anxiety, the menopausal side effects, the side effects with your constipation, diarrhea, your sore mouth. We hide this. We put on makeup, we dress up, we look fine. But I've been struggling. And I've stopped one of my cancer drugs because I just couldn't cope with the side effects. I had a really sore mouth. And I have to live with that guilt and fear that it might make it come back. But I made that decision with my doctor, and at the moment I'm cancer-free and I'm doing what I can. I'm working on the next book. I've got plans to try and be as busy as possible, all in a way to kind of help people. But it's really made me realise that life is precious, and this sounds really twee. You can do what you like. I thought when I was 50, I'd be wearing twin sets and pearls. I'd be old, and now I'm 50 and I'm not. And it kind of gives you a chance to...
Please look up Liz online and you'll see that she isn't wearing twin set and pearls.
But cancer gives you a chance to try and explore new things and be a different person and try on different hats. And that's been really, really fun. I think one of the hard things about being a cancer patient and a cancer doctor is I get lots of heartfelt messages from people sharing their stories, and there are times when it triggers me because I feel I'm a doctor online, but there are times when I'm being a patient, and that can be quite hard to balance what you do.
Several cancer patients have said to me on this podcast and when they've come into Cancer Support Suffolk, I'm really still struggling a little bit. I've rung the bell, or I've metaphorically rung the bell, that I'm cancer-free and all is well. But I've still got lots of side effects. You know, I know a couple of people, for instance, who have had bowel cancer. You know, their bowel movements are all over the place. they may not go for a long time, or all of a sudden they may have to go straight. There are all sorts of things going on in people's lives. So it's that moment when you say, oh yeah, I'm cancer-free, and everybody thinks it's all over.
Yes.
But it's not, is it?
No.
It's not all over.
They want their lives to go back to normal because they've been worried. Yes, great treatment's finished. But for us, you live with the side effects, the scars, the emotional damage, the friends who've ghosted you, that I can't go on a plane for more than 4 hours because I need to get to the toilet. It impacts every area of your life. And I think that's where support networks, talking to other cancer patients, knowing this is normal and you're not alone, can really, really help. Because you don't want to whinge to your family all the while. They don't want to hear it. And you want your life to go on. But I find it really hard living with the permanent menopausal side effects. It's become part of my life and I've accepted it. But I never used to tell patients that, 6 months of hot flushes, a bit of vaginal dryness, you'll be fine. And it's not that. Because as a doctor, I don't know. And that's why I think hearing patients talk honestly about what it's like can help you.
And do you talk to the medical profession? Are you feeding back to them what you're learning out here on the street?
I do. I talk a lot about communication. I used to say, it's good we've caught it early. It's lucky it hasn't spread. But no cancer's lucky to have. And you don't get the impact of your words until you're hearing them. And I say it is pointless doing the latest robotic surgery and radiotherapy and the latest chemo drugs if they have no life. You need to tell them what to eat. Because people are searching. There are 10,000 cancer diet books on Amazon, most written by patients and idiots, pardon me. We need to tell them how to get their intimate lives back. It affects your sex life, every aspect of your intimacy, body confidence. We need to tell them how to cope with the fear of recurrence. All these little things, the importance of exercise to reduce the risk of it coming back. We need to help them live. And doctors don't have time to do this, but we should be digitally signposting them to support services, to websites that can give them the information they need when they're ready to hear it. It's like I'm an ambassador for working with cancer because I didn't realise I was legally disabled. And I struggled to go back to work because they didn't want to give me the time that I needed. And it took me 3 weeks to find that out and say, oh, I have legal rights here. And I was a cancer surgeon and I didn't know that.
It's a lot to learn, isn't there?
It really is.
And a lot of great stuff going on. We must stress that there's so much great stuff going on, but we can always strive to make things better and always should do, shouldn't we?
Yeah.
For everybody. You're an inspiration. It's been fantastic talking to you. You're on LinkedIn is probably your most popular platform, is it?
LinkedIn and Instagram.
Yep. And we can follow you on both of those and see what you're up to and get the latest news on what you're doing. And you've kindly agreed to become involved with us here at Cancer Support Suffolk, which I'm absolutely thrilled about. So I thank you very much for that.
No, thank you.
Your final message for people who are listening to this today, what would you say?
I want you to know that you're not alone. And someone out there is going through what you are, and reach out for support, reach out for help. Cancer can hit you months or years down the line. So please contact your local support services and let them get you through it.
Wonderful. Liz, thank you very much for joining us on the Cancer Support Suffolk podcast this week. Thank you very much for listening as well to this episode. If you'd like more information about what we do, head to cancersupportsuffolk.co.uk, or you can call us 01473 211 884. We're based in Ipswich in Suffolk. We're here to help you or a loved one. Cancer Support Suffolk is passionate about educating and supporting the people of Suffolk, and as a registered charity we rely on donations and fundraising to be able to continue our vital work in the community. Until next time, goodbye.